What's up, guys? My name is John Hawes, RNCCRN with NRSNG.com, where our goal is to give you the tools and the confidence that you need to succeed in nursing school, on the NCLEX, and in your life as a nurse. To help you succeed on this journey, we've created weekly cheat sheets that we send to you every single Friday. To sign up, head over to NRSNG.com/freebies. That's NRSNG.com/freebies. And every single Friday, we'll send you a cheat sheet on pediatrics, OB, med-surg, mental health, ICU, critical care, every single aspect of nursing care to help you succeed. That's NRSNG.com/freebies. All right, now let's roll into the show.
What's up, guys? This is Katie Kleber here with an episode of the NRSNG podcast. And today I want to talk about a really important topic. This is a topic that will affect every single one of you, no matter what aspect of nursing you work in. And this is medication errors. So I think in school you get this impression that when you become a nurse, somehow you're perfect and infallible and you'll never mess up. And the only people that do mess up are terrible nurses. Well, I'm here to dispel that thought process. We are human, we are fallible, and we will make mistakes. We will be exhausted, we will be distracted, or some people will be careless. I pray that is not the reason behind a mistake, but that is the reality of the world that we live in. And if we pretend that we can't and won't make mistakes, then it's a lot harder to prevent them. So let's talk about ways to avoid them. And I know you get in school and people tell you, well, never get distracted and never interrupt. But let's be real. You're given meds and 7 people walk in the room, or you're scanning your meds and 4 people peek their head in. Hey, your new admission's here. Hey, the doctor's on the phone. Hey, a family member's on the phone. That's the reality of what we work in. So I'm going to give you some tips to empower you as a nurse and as a student nurse to be the best you can when you're given meds. And sometimes we need permission, I feel like, or need to be empowered to say to people, to say, hey, this is the priority right now. I'll get to that in a minute, and focus on what we're doing. So I'm going to give you some very practical tips on ways to avoid med errors as not only as an experienced nurse, but as a nurse that has had med errors before. I have another podcast where I talk about what to do when one occurs, but let's talk about how to avoid them in the first place, aside from the very fluffy answer of don't be distracted. Let's talk real specific. So when you're giving meds, a lot of patients and a lot of, honestly, people don't like silence. They feel awkward and they feel like they need to talk. And I've noticed that with so many patients that I have to truly say something, or, hey, right now I'm going to be looking at your medications. I just need a couple minutes to make sure I'm focused and I have everything situated. So if you hang on a second, and then we'll chat a little bit more. Don't start conversation or simultaneously do 2 things while you're giving meds. The way to survive as a nurse is to be a multitasker. But this is the one task where you cannot multitask, if that makes sense. So it's okay to say to a patient, hold on a second, let me just focus real quick. Many times, I've said that many times, and a lot of times the patient's like, oh, you're right, I'm sorry. They realize, oh, you do need to focus and I didn't even realize I was talking while you're doing this because you're doing it so seamlessly. So do not be afraid to say something to a patient. And another tip too is patients, for some reason, don't equate setting up an IV pump or dealing with IV stuff as meds for some reason, I don't think. I get a lot of patients and family members trying to talk to me while I'm programming an IV pump. And that honestly, I feel like more patients and families understand to hush hush when I'm looking at the computer or dealing with like oral meds. But when I walk over to that IV pump, it's like, okay, let's talk. And it's like, I need to focus, because that is just as important, if not more important, to focus while programming your pump. So don't be afraid to say it in a very nice, polite way that, hey, I'm just going to focus real quick. I really want to hear what you have to say, but hold on, let me just eye on the tiger for a little bit here and make it into a little joke, and then that'll lighten the mood. And so this applies when you are scanning in the meds, when you're using equipment that has to do with medications. And this kind of goes into my next one. So like, especially too, when you're working with like an arterial line at blood pressure, and you're looking at that to dictate maybe medication that you're going to give. You know, a lot of us have patients that'll have PRN blood pressure meds to give. So if the blood pressure, the systolic blood pressure is greater than 160, I want you to give, 10 milligrams of hydralazine. If it's greater than 170, I want 20 milligrams. So it's important to double check those vitals before treating them. So if I have, like when I would work on the floor and my CNAs would get vital signs, and then I'd have one, hey, bed 72, his blood pressure was 170. Okay, thank you for letting me know. I'd grab the med if it was on my way, and then I'd go in the room and I would double check the blood pressure. Or if the CNA was going back in there, I would say to double check it. Although the CNAs on that unit got very used to double checking when they had a higher number, just to verify that, yes, this is indeed the correct blood pressure. You never know, especially in like ICU when we leave the blood pressure cuffs on the patients. Sometimes they slip down and the blood pressure reading is not accurate. So we have to go back and double check before we treat. That can help you prevent a med error by giving a med when it really wasn't indicated, because you're treating a false number, or I guess an inaccurate number. Excuse me. So, number one, focus, and it's okay to tell the patient to be quiet or that you need to focus, especially when you're working with equipment and drawing up medications. The second one, double check your vitals before treating them. My third one is to label your tubing and trace your tubing on your IV pumps. I know this sounds simple and basic, but if you can quickly look at pumps, especially if you have 2 or 3 medications infusing via IV, or 6, 7, 8, 9, 10, if you're working in an ICU or CVOR or RU or something, you may have a ton of medications going through, and that's a ton of lines. And a ton of opportunity for error, like with all of those ports. So, something I'd like to do, if I had more than 2 things running, and if I had an IV pump that didn't flash the name of the medication that's being given, because some pumps don't do that, or sometimes they do, but it's not readily, like you can't see it real easily, I would write it on a piece of tape and put it on the IV pump, so that when I glanced at that tower not tubing, when I glanced at that tower of IV pumps, I knew, hey, morphine's on top, the saline carrier's below, Versed's below, then I've got my Levophed, so I could easily see where they were. And then I would label them not only close to the patient, so at the port closest to the patient nearby, I would also label it behind the pump. So that means between the bag of IV fluid or whatever it is, and a lot of tubing in a pump. I would label it there as well, so that I could easily see up at the top what each was. And make sure when you're connecting and disconnecting that you're double checking by tracing the tubing. And if you have them labeled, it is a lot quicker and easier to see what's what, because you can tell very quickly. Especially a lot of tubing labels are brightly colored, which is wonderful. Kind of helps you differentiate a little faster. That way, if you trace before you connect and double check, you trace and double check, you pop whatever it is on or take it off, and then before you leave you check, or before you let go, you double check again to make sure, yes, I'm disconnecting or connecting this to the correct one. And then you make sure, if you're starting an IV antibiotic, you're starting anything, that you see that it drips before you leave out of the room. Many pumps, when you're administering something via secondary tubing, like most frequently an antibiotic, if you don't have it to the appropriate height, it may pull from the wrong bag. So you have to make sure that the actual antibiotic is infusing instead of like the saline carrier that it's connected to. So make sure that that is dripping before you leave the room, because that's something that it's not going to alarm and tell you, hey, I'm giving them saline instead of antibiotic, because it's coming from the same line. The pump thinks I've given, 250 cc's of vancomycin. So you got to make sure that that's dripping before you leave. So IV tubing and IV pumps, making sure they're programmed appropriately. You're focusing when you're programming them. You're tracing your tubing, you're labeling your tubing, and you're making your pumps organized. That's really important. Here's another great tip, not for IV meds, well, for maybe IV push meds. So let's say you're scanning your 9 o'clock meds and you've got 10 pills and 2 IVs stuff. You're scanning it. And usually whenever a partial dose is necessary, or maybe 2 tabs, 3 tabs, you'll scan the 1 barcode and then it'll say, partial dose, or it'll give you that little warning to remind you to cut the pill or do whatever. So I encourage you to, because the tendency is to, let me just scan everything real quick and then I'll go back and cut it. But the more time between all the scanning and then going back and cutting, the more room for error. Because, hey, when I'm scanning the other ones, that gives, maybe someone's going to pop in and say something and then I'm going to forget to cut the pill, or I'm going to forget to go grab another one, or I'm going to forget to do the partial dose. So as that warning flashes up, go ahead and stop scanning, put the scanner down, and cut the pill, and make sure your dosage correct. Your dosage is correct. And then my last one is, and I want to empower you guys with, never interrupt a med pass for anything. I am a people pleaser. It is really challenging for me to tell people no, or to kind of push back a little about what I need. But it's important to do that when you're giving medication. So that means I'm in here, I'm giving my patient medications, and someone pops in and says the doctor's on the phone. Okay, that's great, even if it's a doctor that I've been trying to get a hold of. I'll say, can you let them know I'm in the middle of giving meds? It'll be a couple minutes, or I can call if they want to give me a number to call them in 5-10 minutes. I am not going to leave that med pass to go talk to the physician or a family member or anyone. I am in the middle of a med pass. Those typically don't take too long, but if I stop what I'm doing, leave the room, and then come back, that's definitely huge room for error. So truly, unless there is an urgent, emergent situation going on, make sure that you are focusing and finishing what you're doing. And it is okay to tell people to wait. When you're a nurse, everyone has to kind of come to you for the patient because you're home base. But what happens is everybody thinks that whatever's going on with them is the priority. And when I say them, I mean members of the healthcare team. So you have to understand what is the most important, looking at everybody's requests. Like, I know I've had times where the physical therapist wanted to work with them, the doctor was rounding, the caseworker wanted to do this, they wanted me to do this, and this person, and there was a family member on the phone. And then it's like, wait a second, this patient is hypertensive right now, and I need to give them blood pressure medicine. So all 5 of you have to wait because I need to give this patient blood pressure medication. And I've had people get frustrated and get mad that I couldn't attend to their need immediately. But at the end of the day, I'm in the middle of a med pass. I'm in the middle of doing what I need to do for the patient. And I am the one that has the view of everybody, really. I have the view of what all needs to be done for this person right now. So I, unfortunately, sometimes have the not so awesome job of telling people that their need is not the priority right now. Hey, I will get to you in a moment, or the patient will be ready for physical therapy in about 20 minutes. I know you came up now, but hey, they're in the bathroom, maybe the physician's talking to them or whatever, so that kind of falls into the role of the nurse. And it was really tough for me in the beginning, because I really wanted to make everybody happy and do everything, so it was like everyone was happy. But at the end of the day, and many days, that is not possible. And I had to be okay with disappointing some people for the greater good of the patient. So those are my tips. Remember, focus when you're giving them. given meds, double check your vitals before treating them. Label and trace your tubing and making sure it's dripping, the correct ones are dripping before you leave the room every single time. When you're scanning those medications, make sure that as you get the warning to cut or do a partial dose or to do whatever, you do it when the warning pops up, and don't finish scanning and going back. And never interrupt a med pass for anything unless someone is legit, urgent, emergent situation. So those are my tips. I hope this is helpful to you. You will do all that we can to prevent a med error, but sometimes they happen. Sometimes it's us being too rushed. Maybe we're not practicing the way we should be, or maybe there's a flaw in the system. So if we pretend like we didn't have a med error, we don't report it appropriately, or we don't participate in the solution, that we're enabling and potentially others to fall down that same path. So it's important to address these med errors as they occur, and making sure that we're taking accountability if we have committed one, and making sure that we're doing all we can every day to prevent them. And if it does happen, we learn from it, we move on, and do what we can. So thank you guys so much for listening today. I hope this helps and encourages you.
All right. I hope that was helpful today, guys. I hope that gave you some motivation, some inspiration to go out and to be your best self, to go out and to become the nurse that you want to be, to make a difference, and to do the best work that you can. Listen, we're here to help you along your way. At NRSNG.com, our goal is to give you tools and competence to help you in nursing school, on the NCLEX, and in life. One of those tools we created is our Friday freebies, these weekly PDF cheat sheets that you can refer to on the clinical floor, in the classroom, and just throughout your entire career as a nurse. To get these cheat sheets, head over to nrsng.com/freebies. That's nrsng.com/freebies. You guys, if you need anything, we're here for you. You can reach out to us on social media or via email at contact@nrsng.com. We want you to succeed. We want to help you along the way. We're here to hold your hand. We're here to give you the tools, the confidence that you need to achieve success in this journey to nurse. All right, so you guys know what time it is now. It's time to go out and be your best self today. Happy nursing.